Hello, I'm Margaret Chigani, and this is Straight Talk. With me today is Mr. Patrick Nip. Patrick Nip, you are the Secretary for Civil Service.
Yes, Michael.
And we're here to talk about vaccines.
Yes.
Now, a lot of people wonder why the Secretary for Civil Service is handling the vaccine rollout.
Well, basically, fighting the epidemic is not just the work of the Food and Health Bureau or the Department of Health or the Hospital Authority. It's the whole government, together with the whole society. So every bureau and departments basically have been actively engaging in anti-epidemic work in the past year. So with this project of vaccination, I, together with Professor Sophia Chan, the Secretary for Food and Health, co-chair a task force.
But why the Secretary for Civil Service?
Well, basically, I guess because it involved a lot of mobilization, not just civil servants, but also the health and medical sectors. And I think based on the experience that we had in the universal community testing programs in September.
You handled that too, I remember.
Yes, I handled that. So we gathered some useful experience. And I hope that, I'm sure that would be useful in doing this vaccination program.
Now, Secretary Nip, the one thing that people really want to know about this vaccination program is who is first in line, who gets it first. That's what everybody wants to know.
Okay. For those who receive the vaccination, because the vaccines are in short supply globally, and
we have 1 million coming, I think, next.
Now, basically,
month, right?
we purchase 3 types of vaccines, a total of 22 million doses. So basically, it's 1.5 times of the whole population. So it's sufficient for everyone of the community to get vaccinated. But the arrival time of each vaccine will be different. And on present showing, likely that the BioNTech and also the Sinovac might arrive early. And for the Oxford AstraZeneca, probably would arrive Hong Kong mid this year. So we focus on the BioNTech and the Sinovac vaccines. And we are making all the preparation so that once these vaccines arrive in Hong Kong, the vaccination program could be launched shortly.
Yeah, but the question was, who gets it first?
Yeah. Well, according to the World Health Organization and also our experts in joint scientific committees, they recommend a priority groups list.
And that is?
And, well, basically those who high-risk exposure to COVID-19 or those who once got infected would have adverse serious consequences. So that include healthcare workers and also residents in elderly homes or homes for the persons with disabilities and those working there. And also the older adults, the elderly.
Well, you know, some countries are saying that when you know, healthcare workers, obviously, people in old people's home, obviously. But then some countries are saying that, okay, first of all, after those, you have elderly people, as you said.
Yeah.
But they gave an age limit. Some have 85 and above, some have 70 and above. What's Hong Kong's age limit going to be?
Well, we are working on it. Basically, we do it in phases. So it very much depends on the supply and the, you know, the population. So we could start at 80 or start at 70s or start at 60. No, not yet decided. We are now working on it.
Do you have an exact date as to when the vaccines will come?
The estimation is that the vaccines might arrive in Hong Kong in February.
How many?
So we are planning to have the vaccination program started shortly after the Lunar New Year holiday.
Okay, how many will come first?
For the BioNTech, the first batch, there would be 1 million doses arriving. So we are in close contact with the suppliers. And once the dates are confirmed, then we will work out the, you know, details.
So you haven't got an exact date now. Now, some countries, especially the UK, you know, they're saying not wait for a person to have 2 shots. Supposing you got 1 million, and then they will do 500,000, then another 500,000 for the same group of people. But the UK is saying no, just do them one shot first and then wait for more supplies to come. Will Hong Kong do that? So you can inject more people, protect more people.
Well, I know that arrangement aroused some controversies. In the case of Hong Kong, I think it's different from US, UK, or Europe, where the epidemic situations is very severe. And they might have different considerations. But in the case of Hong Kong, we would like to have the vaccination program started safely, smoothly, and orderly.
So everybody gets two shots.
It's important that we get sufficient supply of vaccines, and for everyone to get 2 doses. So in our booking systems, for one to book for the vaccination, book for the first day of vaccination, at the same time they'll book for the second dose.
So you will not go with everybody getting one shot first and then waiting for more supplies to come for a second shot.
But we'll arrange our vaccination program in accordance with the supply of vaccines that are sufficient for those who get vaccinated to have 2 doses.
Okay. Now, another thing that a lot of people want to know is, where will you go to get vaccinated? I know you're going to have centers in all 18 districts, right? I mean, what kind of an operation is that going to be? Some countries, like, for example, the US, said that they were going to have a number of people vaccinated, but they've fallen behind that schedule, right? How long will it take for this government to vaccinate everybody?
Well, firstly, on the channels, we want to make it as easily accessible by Hong Kong people. And depending on different types of recipients, we might have different arrangements. And also depending on the type of vaccines that we are using, they have different requirements in, for example, in cold chain management and all that. So basically, there are 4 available channels. First, we will set up community vaccination centers throughout the districts. The territories are altogether 18 districts.
And how many centers will you have?
We are planning for at least 1 in
each district? So there's only 18 centers?
Yes. But at the same time, for those residents in elderly homes, we would arrange outreaching teams to go there and do the vaccination. Thirdly, is that through private hospitals and private doctors, they are now doing the annual flu vaccination. So they are used to it. I will arrange, through these networks so that they can help the vaccination. And of
can
course,
you go to the private doctor and pay for it instead of waiting?
Well, we have to do it in accordance with the priority groups and target groups because the vaccines are in short supply. So we have
So the private doctors cannot order their own vaccines, or you supply them, and then ordinary people, not within the groups you have described, can go and pay for it.
Well, this is a government vaccination program. So it will be coordinated and steered by the government. We are asking the private doctors and private hospitals to help in the vaccination. So we'll make use of the, annual flu vaccination systems to enable, people to go to the private doctors, their family doctors, to get vaccination. Government will provide subsidy to the family doctors, but we hope and we expect that they would not, charge additional fees.
So are the vaccines free for everybody? You just mentioned subsidies.
Yes. Now there are several principles. So it's vaccines that are a government vaccination program. It's based on science. It's a voluntary with informed consent, and it's free for all Hong Kong people.
Then why do you say subsidies in the private?
Subsidy is subsidies for the doctors, for the family doctors to do the vaccination. Because
so you're paying money to the doctor?
Yeah, we're paying money to the doctor. Okay. And for Hong Kong people, for you, you just go there and it's free.
Okay, now, one thing that also, Israel, for example, they're about, 9 million people, and they were very, very efficient in vaccinating a lot of people, right? A lot of them have already been vaccinated in a very short period of time. So I ask you again, we have 7.5 million people. How long do you think it'll be before everybody's vaccinated?
Now, it depends on the supply of vaccines, because I know that, for example, some vaccines that we ordered, they would arrive in Hong Kong by batches and lasting for a period of 6 months. So our initial plan is to have our community vaccination centers to be in operation for 6 months. But of course, we would arrange all the logistics and arrangements so that we could vaccinate those who wish to be vaccinated as soon as possible. And we would make reference to the practice in other places, and so that we could do it most efficiently, but also very important, safely. So in the vaccination centers, apart from the vaccination booth, you need to have observation areas for people to...
after taking the shot,
after taking the shot,
okay.
Stay there for 15 to 30 minutes.
But so you're saying, Mr. Nip, that you don't know how long this program is going to last.
Now,
you mentioned 6 months.
Now, it depends on the supply of vaccines. It also depends on the community response, because it's a voluntary, with informed consent arrangements. So we hope that we could do it as quickly as possible, as long as there is demand, as long as there is sufficient supply, we'll do it. I mean, logistically, planning and all that, do it in the most efficient way. So it's difficult to say at this stage, to say that, wow, I will complete the whole vaccination program within a certain period of time. We certainly would, assess that when we go along with the preparation.
Quick break, see you soon, don't go away. Thanks for staying with us. This is Straight Talk. With me is Mr. Patrick Nip. He's the Secretary for Civil Service, and he's one of the people in charge of the vaccination programs. Now, Mr. Nip, you mentioned, how long it'll take depends on the response, right? Now, the last time we did something like this was testing, and it was voluntary as well, and only 1.7 or 1.8 million people tested out of 7.5 million people. Do you expect that response again to be not as satisfactory like the testing or the vaccination?
Difficult to assess at this stage, because this is a new vaccines, and people understandably have the sort of questions or queries and all that. So first things, it's very important for us to have an open and transparent policy to disseminate information relating to the vaccines. Including, why one should be vaccinated, and what are the likely, side effects and all that. So, as you can see, our experts have been, doing a lot of these explanations these days, and we'll continue with that. And secondly is that, we have to explain to the public clearly why we should get vaccinated, because it's protect yourself against falling sick or against severe disease. And also, it's important to protect the community. And based on the science and the clinical data, I'm sure that our experts would tell us, the extent that the vaccines could help in reducing the risk of getting infected, and also reducing the risk of getting, transmission. So these are important information that the public has to know. Secondly is that, of course, we would explain that with vaccination, this is a very important anti-epidemic measure. It will not end COVID-19 alone, but just like the WHO said, the vaccination will be a game changer. So it's important for us to get vaccinated.
When you say game changer now, do you have any kind of a plan or target? If, for example, the response is not that good, it is now a voluntary program. If, for example, less than half the population want to take it, will you then make it compulsory?
Well, I think if you look all around the world, basically this is a voluntary program with informed consent. But I'm sure that our experts are looking at questions like, if one get vaccinated, would there be any difference in terms of, say, traveling and then back to Hong Kong, arriving in the Hong Kong airport, and get the test a negative results, would there be any change in the quarantine policy? Would still be required to stay, be quarantined for at present 21 days or normal 14 days? Would there be any relaxation? That's point number one. Point number two is that in our, normal living, attending premises and all that, whether there would be any change in the policies regarding social distancing measures. Now that would help in resuming the normal ways of life of every individual. So we'll look at these areas.
So what you're saying is you will not make it compulsory, but what you will do is that people who get vaccinated will be treated differently from those who don't get vaccinated.
Well, I would say that we would, this is a voluntary scheme. Everyone who get vaccinated will have to give the informed consent. And thirdly, it's important for us to disseminate, important and factual information to the public. And also, we have to assess, the extent about our quarantine policies or other social distancing measures.
So what you're saying is, you're saying, I'm not going to make it compulsory, but if you take it, then you will be treated in a different way. For example, if you go abroad and you come back, you may not have to be quarantined if you've taken the vaccination, right? You also talked about perhaps discussing with other countries that people who have been vaccinated abroad may be able to come to Hong Kong without getting quarantine, right? Now, would you be discussing with other countries that, okay, we will vaccinate our people, you vaccinate your people, if both sides can prove that they have been vaccinated, so either way you go, maybe to Europe or coming to Hong Kong, that these people will not be quarantined, that there will be some kind of a travel bubble as long as you have got vaccinated from any country. Is that possible? Are you discussing
Michael,
that?
Firstly, any change in the quarantine policies must be based on science. Mm-hmm. So at the end of the day, we have to base on science, the clinical data about the efficacies of the vaccines. That's the first point. Second, I'm sure that different jurisdictions would have an interest to engage in discussions about measures to facilitate international travel. So I would expect these are the very top on the agenda. Just like travel bubbles, the two places we discuss about the test requirements or the vaccine requirements or the sort of quarantine policies and all that. So certainly we will enter these.
So you're planning to, or you hope to have discussions with other countries where you can have some kind of a travel bubble where both sides, if you can show that you have been vaccinated, then you can come and then there's no quarantine. You will consider that?
Well, I'm sure that the international community, particularly, for example, the aviation industry, the community, will start such discussions, and we will closely monitor this, and also, for example, in discussing about the cross-boundary travel or international travel, I'm sure that not just Hong Kong, but the other jurisdictions will take these into account.
So there's a possibility that one day there will be travel bubbles between places where people have been vaccinated.
Yeah, it very much depends on science and the efficacies, the level of protections of the vaccines, and also how long such protections would last. So with all these, we could then have the risk assessments and then decide on the most appropriate quarantine policies.
When do you think that will happen? I mean, we talk about months or weeks or years where you can have these kind of travel bubbles where both sides have been vaccinated and travel becomes normal again?
Well, I can see that, things might move, very quickly because every day you can see a lot of new developments regarding the epidemic or regarding the vaccine. So take, for example, these vaccines, the development to manufacturing and to marketing and to actual use of it, is a highly compressed timetable. But it's safe, it's based on science, because the whole community, the whole world globally is a concerted effort in developing vaccines, and so that can fight the epidemic.
Now, when do you think, for example, you start this vaccination program, hopefully around Lunar New Year or after, how many people, what percentage of the population should take it before you feel comfortable that there is herd immunity in Hong Kong? Are we talking about 50%, 60%, 70% of the population?
Well, I know figures like 70%, but I know that when we talk about the herd immunity or the effectiveness of this, is not so simple. It's a pretty complicated subject that should best be left to our experts.
So you don't have any target now as to how many people should be vaccinated before you feel comfortable?
No. I think it's important that we secure the supply of vaccine, and the amount of vaccines that we purchase are more than sufficient to cater for our whole population.
Okay. Now, there's very quickly, I think you have talked about this before, about choice of vaccines. Some people say they want this, some people say they want that. Are Hong Kong people going to have a choice?
Well, it would be, shown by the venues that you get vaccinated. Because, for example, the BioNTech vaccines is pretty challenging in logistics and cold chain management. And so it will be, vaccinated at community vaccination centers.
Not at the private clinics, right?
Not at the private
because
clinics.
They can't store it.
And also very limited, time that you have to finish it. And so for the private doctors, the family doctors, there's no problem for them to use to vaccinate.
They'll get the one from the mainland.
They'll get the Sinovac or the AstraZeneca. So if you go to family doctors, probably you will get vaccines. These two types of vaccines.
So if you go to the government centers, it'll be the BioNTech one. If you go to private doctors, it could be the AstraZeneca one or the mainland one, right?
Yeah.
Okay. Last couple of questions. A lot of world leaders, including Joe Biden, the president-elect, and have gone on television to take the shot as a way to convince people to take it, that it is safe. Will you do that? Once you've got a vaccine here, will you go on live TV and take a shot?
Sure. Now, it's important. Vaccines that get vaccinated must have the safety and efficacy assessed and endorsed by our experts, and also authorized for emergency use.
So you will go before the TV cameras. Will the chief executive do the same thing?
Well, I think the chief executive and our, principal officials, we have already stated that we are ready, to get vaccinated, to give the public the confidence, and also, which type of vaccines. Once we start the vaccination, it is safe, it is effective.
So it doesn't matter to you which one comes first. As soon as it's there, you will take it in front of the people.
Yeah, because I'm confident that for those vaccines, the use of vaccinations in Hong Kong, that went through our experts and the government.
End it right there. Thanks for watching. See you next time. Good evening.